I guess let's just start with, have your officers brought any concerns to you, and what are they right now?
Most of the concerns are about the safety equipment and the working environment. We need to make sure that the cells are clean, the cars are clean, any spaces that they use are clean. And as far as the equipment, we need gloves, we need masks, we need gowns. We've got to make sure that guys are protected at all times, and that's what their concerns are.
Have there been shortages of it, or?
You know what? We, the PBA, I got my whole board in, and we do daily reports. And my trustees and delegates that are out there, there's one trustee and 4 delegates for each police precinct. They're out there making sure that we have our things that in place, that we have all our equipment. And if there's a shortage, it gets back to me. I've been working with the commission and make sure that everything gets out to them, as quick as possible. And things seem to be working very smoothly right now.
Okay. And what about in terms of the response calls? So when someone's calling 911, if they're sick and need an ambulance, do police officers go as well, or how is this working?
No, we're absolutely going as well. We've, again, working with the department to limit our exposure. The AMTs are, that's what they do. They're going to be the ones that are going to be getting, unfortunately, down and dirty. But, for a basic aided, our guys will be there. They'll, have the mask and the gloves and the gown when it's necessary. And, they'll help out, with basic aided, they'll get in, but it's not, like I said, not the nitty gritty. But there'll be times when they're absolutely necessary, and they'll be there, helping the AMT get the people that the help that they need.
Have they changed protocols at all for police officers? Like, do they call from the squad car first if they go to a?
Yeah, they've changed protocols. A lot of it, we've been working with the department. We've told them their concerns, and they've been listening. Your basic 911 call where you're calling for like a larceny report. A police officer shouldn't be coming to the house for that, because then you're creating a situation where there's an exposure. Mm-hmm. We're telling people to call the police precinct, and they could do the report over the phone. And as far as protocol with the 80 cases, like I was explaining, we used to just go in with the AMT. Now it's only when the AMT really needs us that we jump in and get involved.
Okay. What about resources for mental health? Have you, any of your members just been expressing extreme exhaustion, personal fear of bringing this home to their families?
Well, the thing that I was talking about earlier, that seems to be the biggest concern of theirs, is that they're protected, that they have everything in place to protect them: the gloves, the masks, the gowns, the protocols, everything's being cleaned. Again, working with the department, I know the department got, I believe, 2 ionizers. Those are the things they use in the planes, and they can spray the cars. And we're getting not just the cars, the workstations, cells, everything. Cleaning that, making sure that we have enough wipes, the Purell, everything that they need, where they feel comfortable. And like I said, we're doing daily reports. We're working with the trustees diligently. They're doing a great job. They're getting all the cops' concerns to us. I'm putting out almost daily president's message to my members on my email. And, it's tremendous feedback. They feel comfortable. We're working on a lot of things to protect them. And that's helping out.
It's helping them feel okay with still going to their and doing their jobs during this
Absolutely.
time. Yeah.
Yes, that's what they want. They want to feel that somebody has their back, and that there's a lot of unknown here, and that we're with that the PBA and the department is there with them, in case anything goes wrong.
And I think that's it, unless there's anything else you wanted to talk about. Any other ways the public can help, or?
Yeah, it's easy. It's just the social, distancing. It's the only way. Stay in your house. And again, I can't stress it. If it's not necessary to call, 911 for something that you can call the station house and, we can take a report over the phone, do that, because, we don't want to be the conduit between bringing the virus to you, so the least exposures that we can have during that time is the best. I mean, like I was saying earlier, we're always going to have exposures because there's still people committing crimes that we're going to have to, take into custody and have hands-on with. There's people that resist arrest, and we're going to have to wrestle with them. There's 80 cases. We're going to have to, physically touch them and move them and help them. So, we just want to limit exposure. Stay in your house. I know it's tough for all of us, but it's the only way we're going to get past this.
Do you have any concerns for public safety as more and more officers get sick and there's not going to be enough people to do the jobs?
Of course, that is always a concern, but at this point, I mean, we have 47 confirmed cases of our officers that were exposed and have the coronavirus. We have over 1,000 exposures to the coronavirus. 1,000 of my police officers have been exposed already, but don't have the virus yet, thank God. So only 47 at this point, and like again, if we're doing everything right, like we've been talking about, hopefully we're limiting the amount of officers that are going to be exposed, and we'll have enough officers to, to do the job. And we're actually getting guys that were infected, and a couple of weeks later they're coming back to work. So it's cycling around right now. So no, police officers will be out there doing their job.
So 47 confirmed right now and 1,000 exposed. Does that mean those 1,000 officers had to stay home for 14 days?
No. You know what? They have to show symptoms. And, we had over, I think, 80 at home, 70, 80 at home, because they were showing symptoms. But thank God, some of them were able to return back to work after 10 days because, they were fine. Thank God.
Okay. And how many are in the department, Nassau Police Department?
Police officers, 1,750, I believe. This department itself is a little over 2,500.
Okay.
Supervising detectives.
Okay. So the 2,500 total supervising detectives and all. Okay. And then the AMTs that you mentioned, they work for the county, but they're not under the umbrella of the PBA in any way.
No, they're not under our umbrella. No.
Right.
They do work for the county. They're under the CSEA umbrella.
They're CSEA. Okay. All right. Thank you very much.